Welcome back, folks, to another episode of The Locals. My name is Ryan Glatzhofer, and on this show, I'm going around the Chicagoland area spotlighting courageous entrepreneurs. And this wonderful woman with me is certainly no different. Please join me in welcoming Dr. Maggie Grothe. Maggie, I really appreciate your time. Really great to meet you.
Thank you for having me.
So we are in your brand new dental facility, Root Dental. Congratulations, you had a grand opening yesterday, if I'm not mistaken.
First day of patient care was yesterday.
It is a gorgeous environment,
Thank you.
Very relaxed space. Kudos to you and all the work that you've done. Let's take it back. What sparked your interest in becoming a dentist?
For most of my early life, wanted to be a country music singer.
No way!
Yeah. Did the auditions, went to Nashville, the whole thing. I took a human physiology class my senior year of high school, fell in love with physiology and the human body and aspired to get into medical school. And then in college, I changed my mind, found dentistry, and I loved how manual it was and how you got more time with patients than the typical doctor's office. It was kind of artistic.
How is it artistic? That's a very unique perspective on dentistry.
One of the things that I'm really passionate about is cosmetic dentistry, so full smile design. You're working in shade and tooth color and things like that. You have to have a very keen eye and work in very detailed ways, which can be artistic.
How did you get started in your dental career?
Right out of dental school, I got a job in a private practice in a very small town in Ohio, and I thought that was my dream job. I landed my dream job. I wanted to be in a small rural town. I wanted to, do private practice, and it was an absolute nightmare. I worked there for 3 months and I got the heck out of there. It was a culture bomb. I worked in corporate for 2 years. That was interesting. I learned a lot. I was very happy to leave. There were a lot of things that I didn't agree with there, and I just got tired of pushing back. Worked in a couple of other private practices before opening here. So in total, I've worked in 7 different dental offices. I would say the one that I really enjoyed, which I do still work at, is a pediatric office. But other than that office, I decided, I'm not going to be happy unless I open my own practice.
What was it about the state of the industry or different things that you dealt with in those positions that ultimately led you to start your own business?
So one thing that I'm really passionate about is taking time with people to figure out the root cause of issues. So when you're in an insurance dependent, heavy patient load office, you don't have time as a dentist to sit down and really talk to patients and figure out, why are they getting cavities? Why are they breaking teeth? Things like that. There was even an office that I was in, I was scolded for taking too much time talking to a patient, and I was in there for like 7 minutes, and I was just diagnosing.
In general, I feel like you pay a lot of money to be seen by a specialist. You walk in, you have maybe a minute and a half with them, and that's done. And I'm like, what was the point?
Exactly.
Don't get me wrong, I value your time and your specialty. There's no attempt at a rapport being formed or a relationship being formed.
Yeah, that's kind of one of the things that I wanted to do differently is I want to get to know everybody. I want to get to know who I'm treating. I don't want to treat strangers. I don't want to feel like it's an assembly line office. When you have 2 minutes to sit down and look at the mouth really quick, you can't diagnose root cause. You're treating symptoms. And for a lot of people, that's fine, and that's what they want in a dentist. So, there's different types of dentists for a reason. There is that corporate feel where you get in, you get your fluoride and your filling, and you're out. And some people want that, and that's okay, but that's not the kind of dentistry that I do. I want to be able to spend more time diagnosing, getting to know people, doing really high quality dentistry, doing sterilization up to code. There are so many corners that are cut. People can get sick from going to the dentist if the standardization procedures are not done to a T, and that's something that we will never get lazy on. We will never cut corners on.
Is it laziness? Is it cost cutting?
Both.
That's a damn shame.
So one way we're different.
Did you ever think that you were going to start your own business, or were you always just going to be part of a team at a different dentistry?
So I was very against starting my own business for quite some time.
Why?
I never wanted to be an owner because I wanted to have a family and I wanted to be a mom. But it turns out you can do both. I thought that, I am gonna be an associate for my whole career because I wanna work and then come home and spend time with my kids. And if I'm an owner, I won't be able to do that. That's completely false. I feel like sometimes we're fed that. You can't do the ambitious thing with the career and be a mom. And I believed that for a long time until I started reading more stories about moms who were executives or who, own businesses that did it and were successful in it. So I've got 2 little girls under the age of 2.5.
Oh, that's so cute.
Yeah, and after my first daughter, Evelyn, came, and I just was so unhappy at the corporate office I was at. I'm like, I'm drained. I'm expending energy anyway, so I might as well do it and put in the grunt work now while they're young so that I can be more present when it matters. Being an owner allows me to have more freedom and more flexibility. So I actually was looking to buy a practice from a retiring dentist. My daughter Whitney, who's a year now, when she was 2 weeks old, we went back to the hospital because she got RSV and it was pretty serious. I had put through an offer to buy his practice and it fell through as we were checking out of the hospital. So
That's
that was
rough.
intense. And I was
so
like,
rough.
I'm done. I'm opening my own. I'm done. I'm tired of waiting on someone else to be ready to sell. So that was last January.
Bringing this space to life. Did you scout different locations? What was your process?
My husband and I went around, and for some of them we brought our daughters with us, so it was all four of us coming around and looking at different spots in the area. I did some demographic research in the area to determine where there was a need for a dentist because I didn't want to go to a super saturated area. And then we wanted, certain demographics like families. I didn't want to be in a strip mall. I didn't want to feel like it was a tunnel. Like I love natural light. And also I love this area. Like the downtown is so cute. We're right across from the river. There's trees. I'm all about trees, as you can probably tell.
When I was driving in for this interview, there's a bridge that you cross and you can literally see the Root Dental sign right across from it. It's like a prominent part of this whole area. It's very cool.
Thank you. Wanting to be like a pillar of the community, that's really the goal, is obviously to do dentistry inside the walls, but I also really want to support the community outside the walls. My family and I, we live like 10 minutes from here.
So what's the difference between traditional dentistry and holistic dentistry, which is what you offer?
Great question. So I'll start by saying there's a spectrum of holistic dentistry, like holistic health, like anything else. So with holistic is way on one side and traditional is on the other side. I'm kind of in the middle.
Okay.
So the way that I approach it is by looking at the connection between the mouth and the rest of the body. So I think traditional dentistry tends to see more the mouth is just the teeth and the tongue, and we treat cavities and that's it. With holistic dentistry, I try to take into effect, what's your diet like? What's your lifestyle like? How are you sleeping? Do you exercise? Because that actually matters when it comes to your mouth, is, full systemic health. If you're getting cavities and you're doing everything right, brushing and flossing, what is your saliva? Looking at root cause as opposed to just treating the symptom. A classic example I like to use is if someone comes in with a cracked tooth, traditional dentistry will say, oh, you've got a crack in your tooth. We're going to put a crown on it. You're good to go. See if your next cleaning. And the holistic side, I say, why did your tooth crack? Teeth are really strong. Enamel is the second strongest substance in nature, only second to diamonds. Teeth don't just crack if you eat an almond. What happened that weakened your tooth? Are you getting cavities? And we don't know, we need to figure out why you're getting cavities. Are you grinding your teeth? Are you breathing through your mouth? What is going on that made that tooth crack? And we'll probably put a crown on it, but we're also gonna figure out why you got that cracked tooth so that we don't have more cracked teeth in the future. Exactly. The other thing that's different too is I try to be very conscious of materials that we use. So whenever we can, trying to limit plastics in the office because there's a big, awareness of microplastics now. So trying to limit that where we can, trying to limit dyes, trying to limit artificial flavorings.
How did you fund this and get started? It can be a scary journey.
It's not cheap, I'll tell you that.
Exactly. Did you pull from savings?
A small business loan. I shopped around at a couple of banks and found the best rate and the best customer service.
When you were making these moves, would you say that you were intimidated and scared? It is not easy. It takes a very ambitious and intelligent woman to pull this off.
Thank you. I was more so excited. It's fun because it's something that I want to do. It kind of makes the push more enjoyable. There's definitely been times where I've been doubled over in fear, literally sick because I'm so terrified. Yeah, it's scary. It's scary at some point because I don't want to screw up.
Insurance, that dictates who you can care for, how many people you can care for.
From my perspective, I have worked in several offices that did take most, if not all, insurances, and I've seen this multiple times where I have worked in general dental practices. In order to account for the write-offs from insurance when you're in network with insurance, you have to cram the schedule with at least double the amount of people in order to keep the doors open. Whereas with out of network, the fees might be a little bit higher, but I can take more time with patients. Insurance a lot of times can dictate treatment and limit what you're doing. And when you're not beholden to the insurance company, you can give patients what they actually need and what they actually deserve. When I've been in an office and this child had an abscess and I was like, okay, well, we need an x-ray because I need to see what's going on. And they're like, well, we can't take one because they've already had this kind of x-ray this year and insurance will deny it. And I'm like, I don't care what insurance denies. I don't care what insurance covers. I'm not letting this kid walk out of this office without me seeing what's going on because there's an abscess that could blow up and this child could end up in the hospital. So I don't really care what insurance covers. We're taking the x-ray, period. I've run into that a lot, or even in another office where I was doing a crown on a woman and by typical standards, this crown was like 15 years old. And a lot of times insurance will be like, okay, if it's at least 10 or 15 years old, insurance will cover the crown. I did the crown, insurance denied. I had all the documentation, everything. We jumped through all the hoops. And it's like, well, why did insurance deny the crown? Because they did. There's literally no explanation, and I didn't get paid.
If folks are looking for a new dentistry and they come to you, like, do you take all insurances?
We're considered out of network. So we help patients maximize their insurance benefits by collecting all the paperwork that's needed and sending the claim to the insurance. And then that insurance reimbursement will go straight to the patient at their home. So we just ask for our full fee up front, and then they get reimbursed from their insurance if they have it.
Gotcha. And I appreciate your openness on this, because I've been in the workforce for 8 years now after college, and it's still frustrating and complex for me to understand how all this stuff works.
We are very transparent with patients about fees, about what treatment is being done. I never ever want a patient to feel like we're starting treatment and they don't know why it's happening or what exactly is happening. And that's kind of the other thing, is taking that time to explain things to patients too.
Along this journey,
yes,
what are some mistakes that you've made? There is no set blueprint for any entrepreneur.
Yeah.
You figure it out, and you hope you don't look stupid.
To be determined.
For maybe other entrepreneurs that they're like, oh, she figured it out, maybe I can too.
I have learned that I am not good at budgeting and organizing the construction process, and made a little bit of a mess of that my very sweet husband, Ben, helped me to organize and clean up. And there was a surprise change order in construction to the tune of about $77,000. That was a huge mess. How the heck did this happen? Oh wait, I forgot to put it in there. So
no pressure.
No pressure. So that was very, very stressful. Another weakness is not delegating earlier on. I kind of tried to do everything myself. Opening a dental practice from scratch is a team sport, and I tried to do too much on my own, and I think that's kind of what got me in a pickle.
What should you have delegated earlier?
Organizing and budgeting things. There was so much with like designing the floor plan, building the office, and building a team, and putting systems in place, and researching every material and the potential systemic effects of it, all the legalities of like opening a business.
Did you have colleagues from your previous jobs or anyone else that acted as a resource to kind of help you navigate this?
The pediatric office that I work at now, they are an incredible support. My brother's a dentist out in Colorado. We're the only two medical people in our family.
All right.
But he owns a practice out in Colorado, so
cool.
He's been a good resource too on certain things. There's a dentist out in Ohio where we lived for a short time, Dr. Steve Marsh, and he has been a wonderful mentor.
An aspiring entrepreneur is looking to you for advice. What do you tell them?
Study. Do your research. I read a ton of books. I listened to podcasts. I watched videos. I took CE on business.
So folks want to try out holistic dentistry. How can they find you?
rootdental.net or go Root Dental on Instagram.
Up in Algonquin.
Yes.
Thank you for your time today. Hoping for nothing but a prosperous business for you.
Thank you, Ryan.
And folks, that does it for another episode of The Locals. If you want more content like this, you know what to do. Hit that subscribe button. We'll see you next time. Thanks so much.
Thank you.